President Trump held a press briefing last night as uncertainty grows over the spread of the coronavirus in the U.S. This comes as stock markets take a hit as a result of the outbreak. The Dow has plunged more than 2,300 points in the last 5 days of trading. The president tried to ease nerves yesterday, saying the risk of Americans getting infected is, quote, low. However, this contradicts the Centers for Disease Control and Prevention, which has said the spread is not a matter of if, but when. Paula Reid has the latest from the White House.
We're very, very ready for this, for anything.
Flanked by health officials, the president said his administration has plans in place for a worst-case scenario, including stockpiling protective equipment and masks.
Every aspect of our society should be prepared.
And Mr. Trump said Vice President Mike Pence will head the task force responsible for monitoring the outbreak and coordinating with local officials across the country on their response to the virus.
I look forward, Mr. President, to serving in this role.
Health officials agreed with the president that the aggressive strategy so far had been working, but were cautious about the future.
We can expect to see more cases in the United States.
Moments later, the president contradicted that.
I don't think it's inevitable.
And there were other discrepancies on how soon a vaccine may be available.
The vaccine is coming along well, and in speaking to the doctors, we think this is something that we can develop fairly rapidly.
Although this is the fastest we have ever gone from a sequence of a virus to a trial, it still will not be any applicable to the epidemic unless we really wait about a year to a year and a half.
Health officials say prevention is crucial.
We don't have any natural immunity, we don't have a vaccine, and we don't have antivirals to treat this. So really, right now, prevention is ounce of cure.
But the administration has been criticized for cutting funding that had been dedicated to coordinating government responses to public health crises.
What he's doing is late, too late, anemic. Hopefully we can make up for the loss of time.
All right, Paula Reid joins us now from the White House with more. So, Paula, despite the back and forth between President Trump and Speaker Pelosi, does the White House plan to work with Congress to fight the virus or to get additional funding?
Look, Vlad, they have to work with Congress if they want that additional $2.5 billion to help combat coronavirus. Now, clearly at the top, House Speaker Nancy Pelosi, President Trump, they're trading these barbs. She called his response anemic. He called her incompetent. And in the same breath, though, insisted that they have to work on the same team. But luckily, they both have teams, and behind the scenes, there is an effort underway to resolve these spending questions. The White House is focused on their $2.5 billion spending package. They want this passed quickly on an accelerated pace. But Senate Minority Leader Chuck Schumer, he has proposed something that's roughly 4 times that, an $8.5 billion package. Now, so far, the White House says they are not willing to get behind that. They believe that their initial $2.5 billion proposal is a snapshot of the immediate priorities that they want to target. But the president said he would potentially be open to spending more money in the future.
As you mentioned in your piece, Paula, the Trump administration has received backlash for cutting funding meant for responses to public health crises. Remind us what exactly the White House has cut back on.
And that's right, Vlad. A lot of the president's critics have said, look, you wouldn't have so much trouble responding to this outbreak if you hadn't spent the past 2 years dismantling a lot of the systems that were in place to respond to this. Not only has the president downsized his National Security Council, he's also eliminated a lot of jobs that were meant to address global pandemics. These cuts, they started around 2018 as the White House focused on eliminating a lot of funding for Obama-era disease security programs. Overall, the president called for about $15 billion in reduced health spending, and a lot of those effects are being felt today as the CDC wants to test people for coronavirus. They're not able to do that to the extent that they would like.
So we've been talking the last couple of days about the role that the stock market is playing in President Trump's messaging regarding the coronavirus. Explain how the president views the market gyrations, the market weakness vis-a-vis his efforts to contain the virus.
Well, as we know, the strong economy is the centerpiece of the president's re-election campaign. And we've learned that behind the scenes over the past few days, he was frustrated that officials within his administration, even if they were scientifically accurate, were not projecting a more optimistic message as the markets were tumbling. That's part of why we saw the president yesterday in his second ever White House briefing room appearance come out and try to allay the concerns of Americans and also investors. He is concerned about what he sees going on in the stock market, even though, as you know, you used to work down on Wall Street, you know that some of this is just the natural ebb and flow. There is a concern that as coronavirus spreads, as will panic among investors and could cause the markets to plummet further.
And there's always tweets, Paula, and folks can go and check those tweets where the president at one point said if the market drops 1,000 points in a day, he should be shot out of a cannon. So let's talk about what efforts the administration has made in the past to respond to the virus and get ahead of it, the spread in the U.S. So, I mean, it's not clear why the president chose to have this press briefing last night.
Well, it appeared he was trying to get a hold of the messaging. He was not happy that there were these mixed messages coming out of the administration. On the one hand, you had his economic advisor trying to assure investors that this was tightly contained, while at the same time officials from the CDC came out and said, look, this outbreak, it's very likely that this will happen in the U.S. and we need to be prepared. He wanted to take control of the messaging, and the way he chose to do that is he made this rare appearance in the briefing room. Vlad, the president, avoids the briefing room because it is a very confined space where you're facing about 100 reporters all shouting questions at you. But last night he took the opportunity to go there and try to convince American people that he has things under control, but there were some unusual moments in this press conference. He would say one thing and be contradicted by one of his officials moments later, and he made no mention during this press briefing of that case in California that has now been confirmed. It has no link to any other. That really just does not jive with his insistence that this could possibly not spread here in the U.S. So a lot of inconsistencies, and it's unclear if he actually achieved his goal of convincing people that he and his administration has this under control.
Yeah, and as I pointed out, there are dozens of tweets of the president when he was just a private citizen attacking President Obama for the administration's response to Ebola. Let me ask you really briefly before you go, Paula, about Vice President Pence's role in this new task force that the president is creating. As you know, a lot of people were sort of scratching their heads. They were very surprised that the president of the United States chose Vice President Pence to lead this because his record as somebody handling major public health crisis is not good. As governor of Indiana during the worst HIV outbreak in the state's history, that happened under his watch in 2015, and a lot of critics blame the vice president's belated response and his opposition to authorizing a needle exchange program. And so I wonder why the president chose Vice President Pence. Reportedly, when cases spiked in his state, he turned to prayer.
So the president decided to choose Vice President Mike Pence to lead this effort to coordinate the local response, because most of this is going to happen at the state level. They're the folks on the ground. They're the first responders. And Vice President's role is to coordinate all of the different officials throughout the administration, make sure resources are getting to state and local officials, make sure they're all coordinated. So from the president's vantage point, from the White House perspective, they thought that he would be the perfect person to do this because he is one of the officials in the administration who's been a state governor, and he would be able to coordinate this response. But as you noted, there was immediate backlash and criticism about Mike Pence's record on leading public health efforts. But here the president said he has no interest in appointing a czar. He does not see the vice president as a czar. He sees him as his vice president, and he wants him to be the one reporting to the president about efforts to contain any outbreak here in the United States.
All right. Paula Reid for us at the White House. Paula, we thank you as always.